Hi guys, I am going to attempt this video stuff here. Some of the feedback that I got from you guys from emails that I've sent out said, you obviously miss being in class and having the lecture portion where, you hear me talking and going through the PowerPoint. So I'm going to attempt to see how these videos work for you guys in terms of going through chapters and kind of doing our lecture through video, even though I can't see you guys, but you can see me and I can really kind of go in depth with the PowerPoints and kind of get it as close to normal as possible. So I wanted to start and see how we do with chapter 16 for pharmacology. I am working on some lighting issues, as you can see there. I did get a fancy whiteboard back there put up. It's not as big as the classrooms, so I'm going to have to adjust the size of my handwriting, which is going to be a little bit difficult, but that will come in huge handy for us when we finish up with this course and start our next course, because we will still be on online instruction at that time. Hopefully it'll be lifted soon, but in the meantime we're just going to kind of keep powering along as we go. So you will have to go back through and review the chapter 16 PowerPoint. You're going to have to read the chapter. I sent out plenty of emails regarding that. Some of your homework assignments have shown me that you are not reading the chapters. You're kind of just searching through the answers. So those of you that responded with your suggestions on how you can improve that, they're great suggestions. Taking your time, breaking down the chapter into sections. I suggest taking notes, finding a quiet place. Unfortunately, libraries aren't an option, but maybe a park, somewhere that's quiet and secluded, where you can get through these chapters. I did find that some students I've had in the past have taken notes, have used highlighters, have created their own sort of Quizlets through, just to kind of help them through that. So one question I did want to address was someone asking about the retention of the information for quizzes and finals, and if we still will do our study guide process for that. Absolutely. I plan to do that via video like this, if this works out well. Otherwise, I'll create a form of study guide for you guys to have. Unfortunately, as of right now, we will not be doing any final exams online. So just quizzes, your daily work assignments, daily discussion boards, and quizzes and homework. Weekly homework will be through the online process right now. Tentatively, when we get back, we'll finish up our lab skills, and we will be doing the final exams at that point. If something changes, I will let you know. So let's go ahead and jump into chapter 16, cancer drugs and chemotherapy. Okay, so your learning objectives for this will be to explain the basic physiology of malignancy and tumor cell growth, identify and provide examples of traditional chemotherapy and cytotoxic drugs, hormonal drug therapies, and targeted drug therapies, identifying the brand and generic names, the indications of these medications, their dosage range, side effects, cautions and considerations associated with these drugs that are commonly used to treat cancer. So cancer is characterized or describes a group of diseases that are characterized by the uncontrolled growth of dysfunctional cells. They're thought to originate from a single cell that has lost its ability to control its growth or proliferation. So essentially there are healthy cells that have gone rogue. When we think about the environment of our bodies, this ties closely into our chemistry section. You guys just reviewed the acid and bases and understanding what happens if our body systems are too acidic, if our body systems are too alkaline, what that recommended balance is, what the pH of our blood should be. And that really ties into cancer as well. So cancer cells thrive in an acidic environment. So if our blood is not in the neutral zone and we're running slightly acidic or even more acidic, maybe not so much to cause acidosis, but even kind of in that realm, then we run the risk of allowing or creating an environment for our cells to turn rogue, and the cancer cells to begin to develop, grow, change, mutate, and kind of take over our different systems. So external factors for developing cancer. So lifestyle choices, smoking, use of tobacco. So not just tobacco use, but in smoking form, but there's tobacco in the e-cigarettes now, or nicotine, I should say, in the e-cigarettes. There's tobacco in the chew, the little pouches that people use. So we're not only looking at just lung cancer, but we're also looking at oral cancers as well, okay, with the tobacco use. Alcohol use. Alcohol use is huge because with alcohol, it does increase the acidity of our system. So the more alcohol use we have, the more of an acidic environment our body has, and we run the risk of developing cancers, and not just specifically liver, because we know that's where the alcohol is processed through, metabolized through, but because our blood is becoming a more acidic environment. Therefore, I mean, technically any of your cells in any area of your body can end up going rogue. Sun exposure. Sun exposure is huge. You know, we talk about the balance of sun exposure for vitamin D absorption, which is essential for our bone growth and health. But at the same time, especially those of us that live in sunny areas like southern Arizona, you know, we don't really think about how much sun we're really exposed to. And if we do, a lot of us are covering up. We're putting on sunscreen, we wear makeup that has SPF in it, and so we're blocking the ability to absorb our vitamin D, but at the same time we're providing our skin the protection it needs from those harmful rays, which can turn into different types of skin cancer, including melanoma. Poor nutrition is huge. Physical inactivity. So these are things that not only tie into obesity and other chronic health conditions, but also increase our risk for developing cancer. So internal factors include immune disorders. Autoimmune diseases play a huge role in someone's likelihood or non-likelihood of getting cancer. If we do not have a fully functioning immune system, then our body is unable to detect and fight off not only infections, but these rogue cells. Hormones play a role as well. So we've talked about this in depth, especially in our previous pharmacology sections. So when you have patients, so let's take a female patient, for example, that is on hormone replacement because they are of menopause age, they run the risk of developing certain types of cancers that are fueled by those hormones, breast cancer in particular. Another example is if a female, you know, had been on birth control for many years, started off very young, that long-term exposure to the excess hormones or additional hormones that the body wouldn't have normally produced puts us at a greater risk for developing those types of cancers. And then you have genetic mutations. Sometimes it's just in the genes. And that's why we have new testing now where you can get gene testing done to see if you're at risk for certain types of cancers. Certain types of cancers are hereditary, they run in family genes, and these tests have allowed us to kind of see the precursors and let us know what our risk factors are or what is the likelihood that we would develop these cancers as well. Take Angelina Jolie, for example. Her mother died at a very young age of ovarian cancer. She had these genetic markers done, genetic tests done, and showed that she was at high risk for developing the types of cancer that her mother had passed away from. And so she made the decision to have a full hysterectomy, removed all her ovaries, all of her reproductive organs, and she even had both breasts removed to prevent any incidence or risk of breast cancer, and that was all based off of the testing that she had done. So drivers of cancers, so oncogenes actually promote cancer formation. They promote the abnormal cell growth. Tumor suppression or suppressor genes. So these turn off or downregulate the proliferation of cancer cells. So these are actually considered the brakes. So if you think about driving a car, you know, when you push your brakes and your car comes to a stop, either fast or slow, you're still coming to a stop. This is what these genes are considered. So they inhibit inappropriate cell growth. Mutations or deletions can result in uncontrolled cell growth. Tumor burden. So tumor burden is defined as the number of cancer cells or the size of the tumor tissue. So the smaller the tumor burden, the more effective chemotherapy will be. So that's one thing that's looked at with the different types of cancers that are there is what is the number, or essentially estimated the number of cancer cells within the body, and what is the size of the tumor. The smaller those numbers are and the smaller the size of the tumors has shown that will allow chemotherapy to be more effective. The larger the tumors are and the more widespread the cancer cells are found within the body, it's a little bit harder for the chemotherapy to treat or cure the cancer. And a lot of times these treatments end up being multi-step or multi-involved processes for trying to cure the cancer. Tumor cell count will never reach 0 from treatment alone. So that's why there's a lot of other things that are added in as well. So surgeries to remove the tumor, radiation to get the rest of the cells or anything that may have been left behind. And normal defense mechanisms will eradicate the remaining cells. So the idea behind that is that we use the chemotherapy, we use the surgeries, we use the radiation treatments, and then we help to boost the immune system to take care of what's left behind. So variables that determine the types of treatment. So a type of tumor. Okay, so depending on the type of cancer and the type of tumor that patients have really drives the way that treatment is going to be offered. The location of the tumor plays a huge role as well. There are certain tumors in the brain that are inoperable, and that's because of the location that they're at. They're just not able to get to it. And then the extent of the disease. So when you think about extent of this disease, think about the different stages of cancer. So they have stage 1, 2, 3, and 4. Stage 1 is the very beginning stages. Stage 2, it's progressed a little bit. 3 and then 4 is when we've hit stage 4, and that's typically where it's the fatality range. And at this point, a lot of times it has metastasized, which means that the tumor has spread from the primary site to other parts of the body. So surgery, so removing or resecting a localized tumor. And the ideal outcome for that is that they not only get all of the tumor itself, but any surrounding tissues that may have some rogue cancer cells found in it as well. So radiation therapy can be used in addition or after surgery, and it delivers radiation from a machine directly at the site of the tumor, so they can remove the tumor surgically, or they can hit it directly with radiation. So they tend to use radiation for tumors that are in difficult areas. and that are difficult to reach with surgery. If the tumor is too large to remove without damaging normal tissue, sometimes tumors within the abdomen kind of wrap themselves around different organs and become attached, and at that point it's a little too dangerous to try to remove them surgically. And then a tumor that's causing pain or impinging on vital organs, as I just said, and then residual tumors left behind after surgery. So let's say they didn't get all of the tumor, or there's a piece of the tumor that they just couldn't remove. They're going to hit that directly with some radiation therapy. So immunotherapy stimulates the immune system to stop or slow the growth of the cancer cells. So examples of what we use are interferons and interleukins. Where they're headed with this type of therapy is to help prevent the immune cells from being turned off by the cancer cells. So essentially they are turning off the immune cells from recognizing that they're a foreign invader, essentially, or that they're causing harm to the body. So chemotherapy, administering drugs to treat cancer, okay, it affects the primary tumor as well as any migrating tumor cells. So not only is the goal to attach the tumor or attack the tumor where it's at, but also to catch any of those little rogue cells that are trying to spread through and cause metastasis, which means spreading to other areas of the body. If you have a tumor in a certain area, it's easier to treat in one location than if it's spread to many, many different locations. So the primary chemotherapy, okay, is the initial treatment of cancer, and the intent of primary chemotherapy is curative. So the goal, the intent of starting with chemotherapy, the first round of defense, is to actually cure the cancer itself. Adjuvant chemotherapy is the retreatment of residual cancer cells after surgically removing or reducing the tumor. So they have gone in and done surgery, they've removed the tumor and even maybe some surrounding tissue and areas, and they're still going to hit it with chemotherapy just to make sure that they've gotten any residual cells or anything that were left behind so it doesn't start developing again. Neoadjuvant chemotherapy is given to shrink a tumor so that it can be completely removed by surgery. So sometimes doctors or cancer doctors will start with chemotherapy specific to shrink